Hi there, my name is Elizabeth Doggett. At the beginning of the WomenLift Health program, I had what I considered to be my dream job, working as a gender advisor to maternal and newborn health programs in low and middle income countries through a US-based nonprofit, one of USAID's implementing partners. In May 2025, I was laid off, along with many, many others, due to the gutting of US foreign assistance. The job of gender and health advisor essentially no longer exists, at least for US-based professionals. In January 2026, I started a new job at Duke University Hospital as a registered nurse, caring for patients undergoing complex family planning procedures. My project is entitled Comparing Birth Center Business Models by Impact on Nurse-Midwife Leadership Development and Professional Wellbeing. Birth centers, also called midwifery centers, are led by nurses and midwives and seek to provide care in alignment with the midwifery model. The midwifery model of care differs from mainstream medical care in that it prioritizes relationships between providers and clients, prioritizes prevention over intervention, and respects the autonomy and decision-making power of women for both midwives themselves and their clients. Birth centers have been shown to have better clinical outcomes for clients compared to clients of comparable risk levels receiving care in hospitals. But less is known about the professional quality of life and leadership development of nurses and midwives who work in birth centers versus those in hospital settings. My expectation is that when birth centers are designed to be a supportive professional environment for midwives and nurses, they're more likely to have better and more equitable outcomes for birthing people and newborns. I believe that many midwifery centers may already be doing so, and that this contributes to their documented positive clinical outcomes. As of 2018, there were over 100 midwifery centers across 56 different countries. In the US, there were 84 birth centers operating between the years 2012 and 2020. This number has doubled compared to the previous decade. Unsurprisingly, I found no publications on the professional well-being or career advancement of birth center midwives or nurses. I interviewed a birth center consultant and former birth center business director in the US who informally shared dozens of different business models operating in the US, including different combinations of nonprofit and for-profit, including sole ownership and group ownership models, standalone birth centers versus alongside midwifery units within hospitals, midwife ownership versus physician ownership, even versus corporation ownership. Some birth centers have a cash pay only model versus those who are able to accept insurance, including private insurance and Medicaid. And some birth centers are accredited and some have made the decision to be non-accredited. There's a need for so many different business models in the US because of wide variations in state level policies on midwifery licensure and wide variations in public and private reimbursement for midwifery care. 2025 has actually been the most distressing, demoralizing year of my professional life. WomenLift Health has been one of the few sparks of hope, helping me continue to see leadership potential in myself, even as I lost not only a job, but a vocation, and finally have accepted a position in a non-leadership role. The program has allowed me to continue feeling connected to other professional women and to take time to reflect on my own strengths and weaknesses as an authentic, inclusive, strategic, and impactful leader. My project helped me to create a path to something that I aspire to in a few years' time, starting a new birth center in my own community. The program gave me the little boost of confidence to give voice to a big idea that I hope will continue to gain traction. The project pushed me to network with people I hadn't met before, to share my long-term vision with others in my network. The most difficult connection has been to continue linking in low and middle income countries, given that I don't have any formal ties with global health anymore. I'm honestly unsure whether I personally even belong in that professional space anymore. given the geopolitical changes of the past year. The most important part of sustaining the momentum from here is not giving up on myself, which has felt like such a tempting trap this year. I am unsure of how my own aspirations will match up with the job market and whether my vision for a new birth center is realistic within the current health system and economy. But the program has equipped me with a strategic mindset to see it as a long game instead of taking to heart the setbacks of the past year. Thanks so much for listening.